Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar K. Please don't forget to subscribe my channel and also please give your valuable comments. So today onwards, we will going to start another important series of talks. Now this is related to challenges of infant feeding. Challenges of infant feeding. Now immediately after birth we have to feed the baby. That means mother has to feed the baby, and breastfeeding is also considered as a right of the baby, right? Okay, breast milk is considered as right of the baby, वो उसका हक है, so it should not be denied. So baby should be fed immediately after birth. Now this particular feeding is not so easy as we say, because we know that the preparation of the mother for the feeding of the baby immediately after birth should be started in the antenatal period itself. From the antenatal period itself, mother has to be motivated for breastfeeding. In the meantime, some of the mechanical or any of the structural problems which may be existing in the mother should be priorly corrected. And enough encouragement should be given to the mother. And also pregnant lady should be educated regarding the importance of the breast milk. So feeding of the baby is not a immediate process. So this is a long-term process and it has to be preferably started in the antenatal period itself. Feeding the baby may be quite easier in the multiparas, but similarly the feeding the baby in the primary may be quite difficult, because primary is not exposed to this type of art of feeding priorly, and she needs a lot of encouragement, lot of motivation and lot of confidence. That too, the early primaries, maybe in the 18th year, 19th year, 20th year, when they are mother, they will have a lot of problems. So there are so many challenges in breastfeeding. There is so many challenges in the infant feeding which has to be understood. Now feeding of the baby, if the baby is preterm, if the baby is low birth weight, that's a different issue. There we have to go for the next level of understanding that we will do later. Now WHO position paper and the recent evidences says that the risk of dying of the babies in the first 28 days of the life is about 33% higher for the newborns who initiated the breastfeeding 2 to 23 hours after the birth. So this is one of the data. This data says that those babies who initiated their breastfeeding, so we are talking about normal babies rather, not preterm, not IUGR or not low birth, etc., because their feeding schedule is different. In the normal babies, in those babies where the breast milk is not initiated within 2 to 23 hours, that means within 1 day, the chance of a neonatal death is about 33% higher than those who are initiated in the first day itself. This is one of the data collected from the WHO worldwide. Now this will increase more than twice, 200%, as high for those who initiated 1 day or longer after birth. That means in those babies where the breast milk is not even initiated even after 1 day also, maybe initiated at 48 hours or 52 hours like that, after 1 day, then the incidence of the death will going to increase to 200%. 200%, that means 33 becomes 66. So this is one of the important data which is given from the WHO position paper and as well as recent evidences. So what I mean to say is this shows the importance of breast milk feeding as early as possible. As early as possible. So what Ayurveda explained by Charaka, so where he says that breast milk should be given immediately after birth. Dakshina Parshve Stanyapanam Kuryat. So in the Jatakarma Samskara, he very clearly says Madhugrita Prashana has to be done. Later, the Udaka Kumbha should be kept above the head level of the baby. And later onwards, he directly says that from the right breast, the breastfeeding has to be initiated. So this is the breast milk schedule given by the Charaka for the normal babies. What Sushruta told after 4 days or 5 days may be preferable for preterm babies or low birth weight babies, that we will not discuss. Charaka's explanation is quite clear, that immediately after birth you have to go for breastfeeding, and that is what these reports are also telling. Those babies put on the breast immediately after the birth, as early as possible, will carry less mortality rates and morbidity rates. Now come to the next part where he says the fuel deficiency in the uterus and also early part of the life, the early nutritional programming to the thrifty phenotype and Barker's hypothesis. So fuel excess in utero and early postnatal life also leads to early onset of metabolic syndromes. Introduction of the complementary food before the age of 4 months increases the risk of obesity. See, these are some of the findings that we have to start from the last one. Introduction of complementary feeding before 4 months of age. Ayurveda always says the complementary feed in the form of Phalaprashana should be given after 6 months, Annaprashana 10th month. But if you are giving any of the complementary feeding, maybe in the form of cow's milk, except the breast milk, before the 4th month, then there is always increased risk of obesity. Now mother has to understand this point, or mother has to be counseled regarding this part, regarding the early weaning procedure. 6 months you have to go for exclusive breastfeeding, that is best. And suppose if you start the weaning period, other weaning food, maybe cow's milk along with the breast milk, maybe cow's milk, most of the time it is practiced, then actually it adds for the risk of obesity. It adds for the risk of obesity, and that has to be avoided. Then fuel excess in uterus. Suppose when the mother is pregnant and she is taking excess of the food, that means calorie available is more. So fuel excess in utero, and also excess food is given during the postnatal life to the baby, also increase the risk of early onset of certain metabolic syndromes. Now, if you see diabetes is one of the metabolic problem, isn't it? So Ayurveda very clearly says if the mother is indulging in more kafaja aharas or madhura aharas, and she is likely to develop a prameha. Okay, so here also they are telling the same thing. Or fuel excess in the uterus or early postnatal life may increase the chance of not only diabetes like metabolic conditions, so many other metabolic conditions like maybe hypothyroidism, etc. Okay, now there are two important hypotheses. One is Barker's hypothesis, another one is thrifty gene hypothesis. Okay, so thrifty gene hypothesis is related to obesity again, and also diabetes mellitus to some extent, proposed by Neil. And Barker's hypothesis is also almost all similar to that. So that we will discuss in the other part. Now come to the another important part. So that is art of infant feeding. Now initially baby was given with the breast milk continuously for 6 months, exclusive breastfeeding. That will be replaced by the complementary feeding there onwards. Now the question is, the problem is, or the point is, the transition of this particular breast milk feeding, exclusive breastfeeding into complementary feeding should be very, very smooth. Or your transition that should be very, very smooth. There should not be any hurdles. Most of the time when you stop the breast milk and start the complementary feeding, so what happens? Maybe child is not taking the complementary feeding as comfortably as that of the breast milk. So baby may land up in certain nutritional problems because you have stopped the breast milk also. Meantime, you are also not giving the proper amount of a complementary feeding also. So although you are aware of the complementary feeding here and you are giving it, but as the baby is not receiving it, baby may land up in certain nutritional problems. So therefore the word is used, it should be very smooth. And smooth transition should be there. जैसा हम सात्म्य से असात्मीकरण से सात्मी जो करते हैं, धीरे 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 करके उसको छोड़ जाता है. Similarly, here also, gradually breastfeeding schedule has to be replaced by the complementary feeding. Suppose the breastfeeding was given previously in the exclusive breastfeeding for 12 to 13 times per day, suppose, so or 10 times per day, then gradually decrease the exclusive breastfeeding for 7 times, and these 3 times will be replaced by the complementary feeding, once in the morning, once in the evening, afternoon, and once in the evening or night hours. So likewise, it has to be done in a very smooth fashion. Otherwise, again, it leads to so many problems, because the period of complementary feeding which we start, maybe 6 month onwards, 7th, 8th month, that also coincides with the period of dentition. Now, during the time of the dentition, baby will have so many other problems like jara, abhipaka, then fever, diarrhea, vomiting, so many other dantodbedajanya vyadhis are there. So baby is having some of the other problems, because of which baby may reject the complementary feeding, and this adds for the condition. So unfortunately, this coincides with the period of dentition. Most of the time, baby will have many problems during the time of the dentition, at least in the form of diarrhea and all those things, vomiting, etc., fever, etc. So therefore, complementary feeding should be given little carefully, and therefore we always use the word smooth transition. So this bridge, there should be a bridge, there should be a proper bridge has to be formed from the exclusive breastfeeding to complementary breastfeeding. And that particular bridge is actually called as a complementary feeding bridge. That bridge is called as complementary feeding bridge, and it is also called as Jelliffy bridge, Jelliffe, Jelliffy bridge. Okay, so that is nothing but family pot feeding with a solid food. Now, when we continue with the art of breastfeeding or infant feeding, the period where we shift the infant from the liquid diet to the solid diet should be very safe and scientific. Now, this is very important. When you are shifting the baby from the liquid diet, maybe exclusive breastfeeding, thereafter the cow's milk or some other top feeding, etc., to that the solid food, like maybe dalia or some family foods. Okay, solid food, it should be very safe and also scientific. Therefore, Ayurveda says that danta jata dashana, that means jata dashanam, that means only after the appearance of the tooth we have to start the solid food, a proper solid food. And now mother has to make the bridge very comfortable, that means very safe, by introducing the semi-solid food. Now, liquid food from first breast milk, that should be replaced by some of the liquid food. Liquid food should be replaced by again the semi-solid food, and semi-solid food should be replaced by the solid food. Exactly, in Ayurveda also the similar thing is told. If you look into Sushrutamrita, he talks about semi-solid food. Okay, so 6th month semi-solid food should be given, and in the 10th month 6th month the solid food should be given, Annaprashana. 6th month he is told in the 6th month itself. But yes, Kashyapa says Annaprashana in the 10th month, but Sushruta says Annaprashana in the 6th month itself. Okay, but he says that 6th month when you are giving Annaprashana, that food should be semi-solid. Okay, now therefore mother has to make the bridge by introducing the semi-solids. Don't directly go from the liquid food to the solid food. In between, take a course of semi-solid food, which makes this particular bridge comfortable. This should be strengthened by 3 pillars. Now, whenever you are going for this infant feeding, that is transition from the liquid food to the solid food, what we say complementary feeding, it should be helped by 3 important things. This is called as 3 pillars of this complementary feeding. What is it? Number 1 is continue breastfeeding. Never stop the breastfeeding completely, because if you stop the breastfeeding completely, in the meantime you are not able to give the expected amount of the complementary feeding, then there will be a nutritional problem. Therefore, don't stop it. Continue at least 3 or 4 times per day along with the complementary feeding. Number 1, don't stop the breastfeeding. Continue the breastfeeding as far as possible. Maybe years together. Nowadays it is mentioned that at least 2 years if it is very good. And further it is told that if the mother is having the breast milk, till she had the breast milk, you continue the breastfeeding. So continue breastfeeding, number 1. Number 2, vegetable proteins should be taken from the different food groups. So when you select the complementary feeding food, So select vegetarian protein, not the animal proteins. Select the vegetarian protein from the different food groups, maybe shimbi dhanya, shokadanya, or falavarga, whatever. Okay, so you frame the diet or complementary feeding such a way that baby, at least ensure that baby is receiving good amount of the vegetarian proteins from the different food source. Now last one is animal proteins. You have to also give the animal proteins. That means continue the breastfeeding, give the vegetable proteins, and give the animal proteins. What I mean to say is that means 3 pillars should be there. Breastfeeding, it contains good amount of carbohydrate, fat, and as well as proteins. Vegetarian proteins are very important. In the meantime, animal proteins are also very important. That means you have to add some of the plant products and you have to add some of the animal products also. No, the animal products that you can add in a infant is preferably the milk. Milk contains good amount of proteins, animal proteins, isn't it? Whatever protein it contains, or even some of the non-veg preparations can be also used. And even Ayurveda also says that Veshavara or Mamsarasa can be given. Okay, in the Annaprasana Samskara also it is told that even the Mamsas can be also given. Different types of Mamsarasas can be also given. And a safety net, now we have added to this the small frequent feeds in between the Akshaya Patra method. There's a group eating and a supplementary feeding from the Anganwadis.